A very good day everyone. In this video we are going to explore acute inflammation and its macroscopic appearances in addition to its benefits and harms to our body. Inflammation can be defined as the body's attempt at self-protection, with the primary aim being to remove the harmful stimuli like dead cells or pathogens such as bacteria, thus allowing healing to occur. There are two types of inflammatory responses, and they are acute and chronic. A good way to differentiate acute and chronic inflammation is that acute inflammation is short-term, which occurs seconds or minutes following injury to a tissue, whereas chronic inflammation is long-term and can last for months or in cases years. Acute inflammation can be caused by either thermal injury, like if your hand was scalded by boiling water, electrical injury, irradiation, which is the damage as a result of exposure to radiation, chemical injury, like if your hand comes into contact with something corrosive such as concentrated sulfuric acid, mechanical trauma, like if you got into a serious accident, and finally biological causes, for instance an infection like flu. Acute inflammation is manifested by the following characteristics. Like if you hit your leg against the wooden frame of a door, you would experience pain. Then the area around the point of contact starts turning red and it swells. To a certain extent it would feel warmer than usual, and depending on the extent of the trauma, there may be a loss of function. Now let us briefly review the acute inflammatory response. We already have cells present in our tissues, for instance Kupffer cells, mastocytes and macrophages that are capable of initiating an acute inflammatory response. Well, it is good to bear in mind that cells of our innate immune system like macrophages have these sensors called pattern recognition receptors that identifies two types of molecules, which are pathogen associated molecular patterns or PAMPs associated with microbial pathogens and damage associated molecular patterns DAMPs, which is associated with host cell components released during cell damage or death. When there is an infection or injury, as shown in the diagram, cells of the innate immunity become activated and releases inflammatory mediators, which are chemicals like histamine and bradykinin. The inflammatory mediators released then stimulates vasodilation, also defined as smooth muscle cell relaxation, which results in increased vascular permeability, causing fluid, plasma proteins and white blood cells, primarily neutrophils, to leak into the surrounding spaces between the tissues. The leakage of those components is otherwise known as an exudate, and its process as exudation. Next, the complement system fends off any invading pathogens, and this is followed by the coagulation and fibrinolysis systems, which are activated by necrosis. Necrosis refers to the death of tissues. The acute inflammatory fluid exudate is composed of several components, which are fluids that are high in plasma protein concentration, fibrin, an insoluble protein formed from fibrinogen during the clotting of blood, neutrophils, which are a type of white blood cell, and macrophages, a large specialized cell that engulfs and digests target cells or foreign molecules. Acute inflammation can macroscopically differ depending on the exudate content, cause and site of injury. Serous inflammation is one whereby the cellular content is low, whereas its protein content is high. Serous resembles serum, which is of a watery nature. An example of a serous inflammation occurring in the body is peritonitis. This is so because the thin membrane of the peritoneum is also a serous membrane with cells that secrete serous fluid. Catarrhal inflammation, on the other hand, refers to mucus hypersecretion. Catarrh is actually defined as inflammation of the mucous membrane, which usually results in free discharge of mucus. An example most commonplace is the common cold. Fibrinous inflammation comprises of exudate, which contains high amounts of fibrin derived from fibrinogen, forming a fibrous network aiding the coagulation of blood. It is good to note that fibrinous should not be confused with fibrous. They are actually a world apart. Fibrinous contains fibrin and is present at the site of wound healing, whereas fibrous contains lots of collagen, usually present in connective tissue. Necrotic inflammation is a type of inflammation that occurs in an area which tissue has died. Hence the term necrotizing, which means dying or decaying. The histological changes associated with such inflammation is rapid necrosis that occurs extensively in a relatively large foci throughout the affected tissue, frequently with little or no cells in the exudate. So foci means a central site in which a disease localizes or develops. Hemorrhagic inflammation, on the other hand, is caused by blood vessel destruction that leads to the leakage of large amounts of red blood cells, resulting in the red coloration of its exudate. An example of a condition with this representation is meningococcal septicemia. Suppurative inflammation occurs when pus-forming organisms locally proliferate, resulting in abscesses. A common cause of skin abscesses is Staphylococcus aureus, which contains the enzyme coagulase. So coagulase cleaves fibrinogen into fibrin, and this traps bacteria and neutrophils. So having dealt with the invader, the neutrophils then die or degenerate, which leads to pus formation. So there are many benefits to an acute inflammatory process and the fluid exudate that ensues. Firstly, toxins are diluted. Pathogenic organisms can sometimes produce toxins that are harmful to the body. Exudative fluid can clear or dilute these toxins, which are consequently drained in the lymphatics. Secondly, it also aids in the entry of antibodies. So increased vascular permeability allows antibodies to enter the extravascular space, where they may lead either to lysis of microorganisms through the participation of a complement or phagocytosis by opsonization. It's important to bear in mind that antibodies are also essential in neutralizing toxins. Thirdly, it induces fibrin formation. Fibrin formation from exudate fibrinogen may impede the movement of microorganisms, trapping them and leaving them susceptible to phagocytosis. Fourth is the delivery of oxygen and nutrients. Delivery of nutrients and oxygen, which is actually essential to cells such as neutrophils, is aided by the increased fluid flow into the area. Next is the stimulation of an immune response. The drainage of fluid exudate into the lymphatics allows particulate and soluble antigens to reach the local lymph nodes where they may stimulate an innate immune response. It is important to bear in mind that acute inflammation is no silver bullet, and it isn't bereft of its share of harmful effects. The harmful effects of a fluid exudate are: first, it disrupts normal tissue. Enzymes such as collagenases and proteases may digest normal tissues, resulting in their destruction. This may result particularly in vascular damage. Next, it causes swelling. The swelling of acutely inflamed tissues may be harmful. For instance, the swelling of the epiglottis in acute epiglottitis in children due to Haemophilus influenza infection may obstruct airways, resulting in death. Finally, the occurrence of an inappropriate immune response. Sometimes acute inflammatory responses appear inappropriate, such as those that occur in type 1 hypersensitivity reactions, for example hay fever, provoked by environmental antigens, for example pollen, which otherwise poses no threat to a healthy individual. Such allergic inflammatory responses may be life-threatening in some cases. So that's all for today. Thanks for watching.